So welcome everyone. Welcome to the Thunderstorm Asthma and Bushfire Smoke Safety webinar, hosted by the Northern Eastern Public Health Unit, or NEPHU for short. My name is Muka Markovic, and I'm the Engagement Officer in NEPHU, and I will be your chair for today's webinar. Also with us today, we have Emma van den Helm, Senior Engagement Officer, who will assist with the slides. Speaking today, we have Dr. Nathan Scott, Public Health Medicine Registrar, who will present on thunderstorm asthma and bushfire smoke safety. So before we start, I would like to acknowledge the traditional owner of the land which we are meeting today and pay my respect to the eldest, past, present, and emerging. A little bit of housekeeping before we start. So the purpose of this webinar is to provide community organizations and leaders within NEPHU catchment with an educational overview of thunderstorm asthma and bushfire smoke. We will also provide communication resources to share with your communities to help spread awareness. We will allow plenty of time after to ask questions. You can ask questions anytime by writing them in the Q&A area, just as you have here below, it's just up. I will now pass over to Dr. Nathan to take us through the overviews. Thank you, Nathan.
Thanks, Muka, and thanks everyone for joining. It's great to have so many people come along to the webinar. And you have to excuse my scratchy voice. I'm feeling a bit under the weather today, but we'll see how we go. So the first topic I'll cover is an overview of thunderstorm asthma. So before diving into thunderstorm asthma, I thought I'd just give a brief overview of asthma itself. So as many of you are probably aware, asthma is a lung condition, and it's a lung condition in which the airways are reacting too fast and too much, usually to stimuli that's harmless to people without asthma, with a few exceptions. So we can see on the diagram on the right-hand side, this normal lung, the airways are nice and open, there's a thin lining, a small amount of mucus, and the muscles are relaxed. So it's allowing good airflow in and out of the lung. In an asthmatic lung, during an asthma attack, that lining's become quite thick, there's excess mucus, and the muscles are too tight. So it's constricting airflow in and out of the lungs, which is really the basis of asthma as a disease. So it's not just a childhood illness. It can start in childhood and continue into adulthood, or it can develop as a new condition in adulthood. The symptoms can vary, but they often include some combination of breathlessness, wheezing, which is that really high-pitched sound during breathing, persistent cough, particularly at night or in the early morning, and tightness in the chest can also occur. Asthma attacks are sudden onset and they can be very distressing, and rarely can also be life-threatening. Thanks, Emma. So what are the triggers for asthma? So there's lots of different triggers. So things like allergens, cigarette smoke, dust and dust mites, fumes and strong odours. So sometimes perfumes can set off asthma attacks in some people. Infections like the common cold, flu or COVID, exercise, cold, dry air, pet dander, and very rarely thunderstorms due to the pollen in the air. So what are the treatments for asthma? Well, broadly speaking, there's two different categories of treatment. So there's relievers and preventers. So relievers are used during an asthma attack, and they act really quickly to relieve those symptoms by relaxing those tight muscles in the airways. And examples that you may have seen in the pharmacy are Ventolin or Asmol. And these should always be used with a spacer to maximize their effectiveness. The spacer is this clear plastic cylinder that we can see attached to the reliever at the bottom there. So preventers, on the other hand, contain steroids, and they act slowly to make the airways less sensitive to triggers. They're often taken daily, and they're less noticeable in effect in the short term, but they do decrease the attack frequency and severity. And there's a few examples on the slide there as well. So then what is epidemic thunderstorm asthma? Simply speaking, it's when a large number of people develop asthma symptoms over a very short period of time due to the environmental conditions caused by thunderstorms paired with high levels of grass pollen in the air. It results in a lot of people having an asthma attack and needing to go to hospital, but is thankfully pretty uncommon. We've only had 6 episodes in the last 40 or so years, with the most recent and severe event being in 2016. So what causes it? Well, as I've sort of already alluded to, it's a combination of high heat, pollen, thunderstorm clouds, and wind. So during the pollen season, which is spring to early summer, there's high levels of ryegrass pollen in the air, which come from the plains of New South Wales and Victoria, and higher temperatures around this time of year increase the pollen counts in the air. Pollen's usually too large to be inhaled into the smaller airways of the lungs, so usually the pollen granules just get trapped in the upper airways. During a thunderstorm, however, pollen grains get lifted up into the clouds where they absorb moisture, and this causes them to burst. So the smaller fragments are much more easily dispersed by wind and can be brought back down to the ground level. So once these pollen fragments are at the ground level, they can then be inhaled into the smaller airways of the lungs, where they'll trigger an allergic asthmatic response in susceptible people. So we can see here on the left a nice formed pollen grain. So this is far too large to be inhaled into the smallest airways of the lungs and will usually be trapped in the upper airways. On the right-hand side, however, we can see that this pollen grains absorb moisture and it's burst, and all of these tiny fragments are small enough that they can be inhaled into the smallest airways of the lungs. So what happened on the 21st of November in 2016? Well, it was a particularly hot day, the hottest day in Melbourne since March that year, 35 degrees, which caused the pollen counts in the air to become really high. And at around 2 in the afternoon, the Bureau of Meteorology issued a thunderstorm warning for Mallee, Wimmera and the northern districts. At around 4 p.m, this warning was extended to Melbourne and Geelong. At 5 p.m, the wind gusts reached Geelong. At around 6 p.m, the storm had reached Melbourne. Between 6 and 7 p.m, there was a rapid uptick in 000 calls and hospital presentations. So we can see here in the first 5 hours, there was just under 2,000 ambulance call-outs and over 8,000 calls in the first 24 hours. Many pharmacies sold out of relievers, which are those medicines which are critical in asthma attacks as well. So what about the first 30 hours? Well, there was around 3,300 excess lung-related presentations to Melbourne and Geelong Public Hospital EDs, which represents just over a 670% increase compared to normal. There were around 470 excess asthma-related hospital presentations, which is close to a 1,000% increase compared to normal. 35 people ended up being admitted to intensive care units, and 9 people unfortunately died due to the thunderstorm asthma event. So who is at most risk of thunderstorm asthma? I think it's important to note that there is not a risk of thunderstorm asthma with every thunderstorm. It's that unique combination of factors, including the daily temperature, pollen counts, thunderstorm clouds, and the wind direction, which contribute to that risk of thunderstorm asthma events. Those who are at increased risk when all of those factors are present are people with asthma, especially people who have poorly controlled asthma. So these might be people who have frequent or severe asthma attacks. People with undiagnosed asthma. So these might be people who have some of the symptoms of asthma but haven't yet been formally diagnosed. People who've had asthma in the past, including childhood asthma. And people with hay fever who may or may not have diagnosed asthma. So what can you do? Well, if you have asthma, it's always best to visit your GP and make an asthma action plan. So that's this blue sheet on the left here, and it shows you what to do when you're well, what to do when you're not well, and what to do if your symptoms are getting worse. If you're on asthma and you take preventer medications, it's always best to take them as prescribed by your GP, which is usually daily, and it's also important to take them even if you're feeling well and you have no symptoms. Other things you can do, so avoiding exposure to thunderstorms, staying indoors during a thunderstorm, especially during those winds that usually precede them. If you do need to go outside, consider using an N95 face mask. These can filter out around 95% of those pollen particles. And if your aircon sits on the outside of your house and brings air in from the outside, it's best to turn it off during a thunderstorm. Carry your reliever and a spacer with you and know how to manage an asthma attack if you do suffer from asthma. If you have an asthma action plan, follow that plan. Otherwise, use the 4 steps of asthma first aid. So I'll just briefly touch on asthma first aid. Many of you have asthma or have lived with someone with asthma will already be familiar with this, so I won't spend too long here. But if someone is experiencing an asthma attack, the first thing to do is to sit them upright in a chair and stay with them. Then if they have their reliever with them, give 4 separate puffs of a reliever. If they have a spacer, make sure you put 1 puff into the spacer chamber at a time, and they'll take 4 breaths from the spacer, and repeat that until you've given 4 puffs. You then wait 4 minutes and reassess. If their breathing's not back to normal, then you repeat step 2. And if after that their breathing's still not back to normal, it's time to call 000 and keep giving those 4 puffs every 4 minutes until emergency assistance arrives. So in summary, epidemic thunderstorm asthma is a potentially serious but thankfully uncommon event. Not all thunderstorms carry a risk of thunderstorm asthma, and later in the talk we'll cover ways to stay informed of the risk. If you have asthma or have had a history of asthma, it's important to see a GP to develop an asthma action plan to follow. And if you or someone you live with has asthma, familiarise yourself with the steps of asthma first aid. So moving on now to an overview of bushfire smoke. So as we all are aware, we've all seen the news, bushfires are increasing in frequency, severity and duration around the globe. And bushfires can lead to a range of health effects and represent different health hazards, including extreme heat and heat stress, physical injuries and smoke exposure. Bushfire smoke is a mixture of hazardous air pollutants, including toxic gases, large particles, and fine particles called PM 2.5, which are the biggest health concern. So why are we so concerned about bushfire smoke? So fine particles in bushfire smoke can cause both short and long-term health effects. Microscopic PM 2.5 particles are breathed deep into the lungs where they can become lodged, or they can enter the bloodstream and travel anywhere in the body. So because of this, PM 2.5 is associated with premature death in the population, and it can cause or exacerbate diseases of many different organ systems. So most commonly heart and lungs, but also brain, skin, gut, kidney, livers, eyes, and nose. So it can wreak havoc anywhere in the body. So what are the symptoms of short-term bushfire smoke exposure? As you generally expect, the main symptoms are symptoms of irritation, so itchy or stinging eyes, sore throat, runny nose, coughing, sometimes and more seriously, shortness of breath or wheezing and chest pain, and it can also cause nausea, vomiting and fatigue. Who's at highest risk? As you'd probably imagine, it depends based on your age, your pre-existing medical conditions, the length of time exposed, and the concentration of smoke in the air. Generally, those who are at the highest risk are children up to 14, adults over 65, smokers, pregnant women, and people with a heart or lung condition or diabetes. So how can you protect yourself? So it's important during a fire to check and follow any emergency fire warnings, including evacuation notices. If you're not under imminent threat from fire, Avoid breathing in bushfire smoke by staying inside with the windows and doors closed. Do not use evaporative air conditioners and only use air conditioners which circulate indoor air. You can consider using a room air cleaner, and if it's smoky outside, it's always best to take it easy and avoid strenuous outdoor activities. So it's not the time to mow the lawn or go for a half marathon. Consider wearing a face mask if you do need to go outside, and N95s again filter out 95% of particles, noting that with PM 2.5 some particles are smaller and will still make it through the mask. People with existing medical conditions, including asthma, should continue to take their medication as planned and follow their treatment plans. And it's always important to seek immediate medical attention if you develop serious symptoms, such as breathing difficulty or chest pain or tightness. So in summary, bushfires are increasing in severity, and as a result, the population is being exposed to bushfire smoke more frequently. Bushfire smoke contains hazardous particles which cause a range of diseases. It's always important to follow emergency fire warnings, and if it's safe to do so, please stay indoors and avoid being exposed in the first place. It's always important to seek medical attention if you develop those serious symptoms, including chest tightness or pain or shortness of breath. Thanks everyone for putting up with my scratchy voice. Any questions?
Thank you, Nathan. We got only one question at the moment. If the slide will be shared after the webinar. So yes, the slide, the resources, and the recording itself will be shared afterwards. We'll send an email. Yes, Emma. I think I might need to take you off mute.
Hi, I was just wondering, Nathan, is it a myth that spaces are only used for children in terms of asthma when you're using a reliever?
Yes, definitely a myth. They should be used for all asthma attacks when using a reliever, including in adults. The reason we recommend them is they increase the effectiveness of drug delivery. So if you're using a reliever directly inhaling from the nozzle into the mouth, a lot of the drug ends up being coated on the tongue and the sides of the mouth, whereas using a spacer chamber disperses the drug throughout the air and allows it to be breathed more deeply into the lungs, where it's going to work and have an effect on the asthma attack. So it should be used for everyone.
Thank you.
Any other questions? You're welcome as well to raise your hand and I'll take you off mute or write it in the Q&A area. Maybe I'll use that time to ask Nathan another question. Nathan, what can we do if someone is having an asthma attack but they don't have a reliever? You talked about the first aid. Anything else we can do if we don't have a reliever?
So if someone's having an asthma attack and they don't have a reliever with them, then you skip straight to the end of the algorithm and you call for assistance straight away. So 000 straight up the bat.
Thank you. And how long is an asthma attack induced by thunderstorm is longer or shorter than regular asthma attack that someone might have?
It actually is. There's a lot of variation individual to individual. So some people have a short, mild episode, and some people will end up needing to go to hospital and require treatment over a longer period of time, sometimes up to 24 hours. So it can vary. We do know that with children during thunderstorm asthma, they tend to present later than adults. So their symptom onset can be a little bit later compared to an adult who's experiencing the same.
Thank you. Got another question in the chat. Would you recommend people with hay fever use a preventative nasal spray over the summer months?
I guess that comes down to individual preference and how severe your symptoms are. If you are one that currently, if you're one that is prone to developing symptoms due to hay fever and that happens on a daily occurrence throughout the pollen season, then you might consider using something on a preventative basis. But for most people, that wouldn't be required.
Thanks, Nathan. Any other questions before we continue? Okay. We can go next slide, Emma. So we'll present the community resources that we made into a bundle for you guys. For the Thunderstorm Asthma, we have a very, very informative page in Better Health channel. Also, the Victorian Department of Health created a campaign toolkit to share within the community with social media and other resources. Another valuable resource is the Thunderstorm multicultural resources. As you can see in the bottom, different language, a few big family of languages, so very highly recommended. Let's continue to the next one. Also, Better Health created a YouTube video series, some of them in different languages, very easy, simple English to kind of educate the community, kids and adults around thunderstorm asthma. Around Bushfire Smoke, very similar, Better Health channel created a very informative in English page, and also the Victorian Department of Health has multicultural resources about bushfire smoke and your health, and as well after a fire, using your personal protective kit. We have it in English and in multiple languages. They're kind of talking about this very sweet comics that is the PM 2.5 that Nathan talked about, so very, very informative. Next one, please. And that's relevant for both. That's a real-time resources. We have here the Vic Emergency website and apps. Highly recommend to download. And you are able as well to see the risk around Victoria of bushfire, bushfire and pollens this summer. Very, very, very relevant and important this season. You can download the app, and the link on the right side is showing you how to really set a thunderstorm asthma alert on your phone. In the bottom as well, we have the Environmental Protection Authority in Victoria that monitoring the quality of air, so pollen and smoke, very relevant kind of to visit, especially on days of very hot days or stormy days. As I said before, all of these links will be shared. We'll send an email to all of you with the slides as well. Next slide. Question. Any questions about the resources or any questions to Nathan that came along now? Let's see if we have anything in the Q&A. Yes. Can we share the recording slides and resources in our networks and newsletters? Yes, please. You are able to. It's going to be available for everyone. Please share it. Of course, maybe a shorter version, but yes. And another question, should people get reviewed by doctor period to the season if they had childhood asthma? That's for you, Nathan.
Yeah, it is a recommendation we make even if you've had a distant history of asthma many years ago. We did see in 2016 that some people who didn't have any adult symptoms until that day were having asthma attacks. So it's worth at least a discussion with your GP and perhaps filling out the first part of that asthma action plan. So you can consider having a reliever on standby in case you did have any symptoms during that season, just keeping one around the house. You wouldn't need to go on preventative medications, but it's just an individual risk assessment based on your other history. For instance, if you suffer from hay fever or have any other allergic diseases like eczema, and your GP will be able to make that determination with you if you are to have any reliever medication around the house as a just in case for the season.
Thank you, Nathan. And one other question, is this resources available in other languages? So yes, I mentioned it before, all of the resources, not all of them, but most of them are in multicultural, multi-language options in the main languages around Victoria. So at least 15 different languages is what I could see. So very valuable to check it. Any other questions before we're going to finish? No. Okay. Next slide, Emma. So before we go, we would love if you will be able to answer a very quick survey, a feedback form for us. If you scan with your phones, you will be able to get to the survey. It's a 5-6 question survey. We'll really appreciate it. I want to thank Dr. Nathan for his knowledgeable slides and a very informative presentation. Thank you for that. And I want to thank you all for attending today's webinar. We greatly appreciate your attendance and participation. We will, as I said before, we will share all of the resources in an email and also the link to the feedback form. We'll appreciate you answering that. Contact us if you need to contact us. Please contact us on engagement.nephu@austin.org.au. And I'll give you back half an hour of your day. Thank you so much for your time, and we'll see you in the next webinar. Thank you, everyone.